I'm Darcie Crow, Senior Wealth Advisor and Senior Portfolio Manager. Today we're going to be talking about one of the largest potential expenses in retirement, which is often highly unpredictable, and that is healthcare. This is something that we are now discussing with clients on a daily basis, whether it be families covering full-time in-home care costs for elderly parents, clients wanting to incorporate these significant long-term care costs into their own retirement plans, or in some cases planning to have parents move in with them to be able to assist with some of the care requirements. These decisions have significant financial and emotional impacts to our lives and need to be thoroughly thought through, openly discussed, and planned for. Canada's aging population has renewed awareness of the importance of healthcare and long-term care planning. However, we know that a majority of Canadians admit to having limited understanding of the healthcare and long-term care options and costs they should be saving for in order to live well in retirement. This topic has been gaining momentum over recent years as we are seeing both an aging population and increasing life expectancy, putting an unprecedented strain on the Canadian healthcare system. There is some confusion surrounding our public healthcare system in Canada and exactly what costs will be covered in retirement. In general, the public healthcare system is designed to be curative in nature, rather than providing ongoing maintenance care. So your visit to the doctor or an unexpected hospital visit, those costs are covered. However, services designed to maintain health generally have far less coverage. So that might include things like long-term care facilities, home care services to enable you to age in home longer, or specific drugs that may not be covered. So to better prepare for some of these uncertainties, we are going to review 3 key healthcare costs to be aware of when planning for your financial future, and then we're going to talk about 4 things that you can do to prepare to live well through your retirement years. So number 1 is the cost of private home care. While publicly funded home care does exist, not everyone will qualify, nor will it always provide the level of support desired or required. So current estimates show that in-home care for 8 hours a day can be upwards of $100,000 per year, and these costs are continuing to rise with the increase in demand for these services. Number 2 is the cost of private residential care. So some of these heartbreaking stories that came from nursing homes in Canada during the COVID pandemic brought to light many failures of our residential care system. The cost of residential care varies widely, but it can range anywhere from $2,500 per month to over $10,000 per month, depending on both the location and the level of care that's required. And number 3 is just the cost of living longer. The number of Canadians living to age 100 and beyond reached a record high in 2021. It is critical that your financial plan and investment portfolio are designed to meet your needs for the full duration of this lifespan to ensure that you can continue the quality of life that you're accustomed to in the future. So knowing these potentially significant costs we might occur in the future, what can you do today to prepare? So first of all is understanding the public healthcare system. If you're planning on putting full reliance on provincial healthcare offered, you need to have a full understanding of the depth of that coverage to avoid any negative surprises in the future. So while government-sponsored health insurance varies from province to province, typically as a retiree, you will be receiving very basic coverage, which does not cover maintenance issues such as dental services and optometry and services of that like. You need to ensure that you're incorporating these costs into your own retirement budget. So that leads us to number 2 is making sure you're budgeting for healthcare costs in retirement. As a general rule of thumb, experts allocate about 15% of retirement income budget to healthcare costs. That might include prescription medication, dental care, other services not covered by public insurance. If there's a shortfall predicted within your financial plan, you want to be aware of that now so you can make the adjustments needed to cover these essential costs in the future. Number 3 is considering purchasing healthcare insurance. So once you know what your budget is going to be for healthcare costs, you can then make an informed decision about purchasing a premium insurance policy such as critical illness, dental insurance, or long-term care insurance if that would be required. And lastly is openly discussing your financial retirement planning with family and a trusted advisor. When families and friends discuss retirement planning, the focus remains on talking about the freedoms of retirement and travel and doing the things that they love. Health and long-term care planning is not yet at the forefront of these discussions, but this really needs to change. Involving your family, friends, and a trusted advisor in these discussions will ensure that you have a thoughtful plan in place to meet your needs over time. So in conclusion, the key to living well in every stage of life, including those retirement years, is to ensure that you have a solid financial strategy in place that considers changes in your health over that time before those changes happen. This will ensure that you have healthcare options available to you to support your lifestyle rather than having to make undesirable decisions to cover these unplanned expenses in the future. Thank you for joining us for this important discussion, as this is something that will impact all of us and our families over time. If you or someone you know is currently working through these healthcare planning matters, we would be happy to speak directly. Please take a moment to like this video and subscribe below. Our goal is to get the information into the hands of those that need it most. Thank you.